Hello everyone, this is Dr. Prashanth and welcome back to Public Health series. In this video, I'll be talking about the health planning in India along with the health committees. Health planning is an integral part of national socio-economic planning, and the guidelines for national health planning were provided by several health committees. These committees are appointed by Government of India from time to time to review the existing health situation and recommend measures for further action. These are some of the health committees. To start with the Boer committee, it is also called as Health Survey and Development Committee. And the purpose was to survey the existing position regarding the health conditions and health organizations in the country and to make recommendations for the future development. Some of the important recommendations are integration of preventive and curative services at all administrative levels and the development of PHCs in two stages. Stage 1, which is also called as short-term measure. Each primary health center should cater to 40,000 people with a secondary health center to serve as a supervisory, coordinating and referral institution. And for each PHC, 2 medical officers, 4 public health nurses, 1 nurse, 4 midwives, 4 trained DIAs, 2 sanitary inspectors, 2 health assistants and 1 pharmacist, along with 15 other class 4 employees. Stage 2, also known as long-term measure, it is also called as 3 million plan. It recommended setting up primary health units with 75 bedded hospitals for each 10,000 to 20,000 population and secondary units with 650 bedded hospitals, again regionalized around district hospitals with 2500 beds. And a 3-month training in preventive and social medicine was recommended to prepare social physicians. And coming to Mudaliar Committee, it is also called as Health Survey and Planning Committee, and the purpose was to survey the progress made in the field of health since submission of the Board Committee's report and to make recommendations for future development and expansion of health services. Some of the important recommendations are consolidation of advances made in the first 2 5-year plans, strengthening of the district hospital with specialist services, each PHC not to serve more than 40,000 population, and to improve the quality of healthcare provided by the PHCs, integration of medical and health services as recommended by the Board Committee. Coming to the next committee, Chada Committee, the purpose was to study the arrangements necessary for maintenance phase of the National Malaria Eradication Program. And some of the important recommendations are the vigilance operations in respect of the National Malaria Eradication Program should be the responsibility of PHCs at the block level. And the vigilance operations through monthly home visits should be implemented through basic health workers. And one basic health worker for 10,000 population was suggested. And along with the malaria vigilance, these basic health workers are also given an extra responsibility to collect vital statistics and family planning duties. So they are treated as multi-purpose workers. And family planning health assistants are recommended to supervise 3 or 4 basic health workers. So due to this extra responsibility, the basic health workers could not function effectively as multi-purpose workers. This eventually led to the appointment of Mukherjee Committee in 1965. And the purpose of Mukherjee Committee was to review the strategy for the family planning program. And some of the important recommendations are separate staff for the family planning program was recommended, and the family planning assistants were to undertake family planning duties only. And it recommended to delink the malaria activities from the family planning. And now coming to Mukherjee Committee 1966, this committee was appointed because of states finding it difficult to take over the whole burden of maintenance phase of malaria and other mass programs like family planning together. So the committee worked out the details of the basic health services which should be provided at the block level and some consequential strengthening required at higher levels of administration. And now coming to the Jungalwala Committee, it is also known as Committee on Integration of Health Services. And the purpose was to examine the service conditions, that is importance and urgency of integration of health services and elimination of private practice by government doctors and submit a report to the central government. Some of the important recommendations related to integration are unified cadre, common seniority, recognition of extra qualifications, equal pay for equal work, special pay for specialized work, and no private practice and good service conditions. And now coming to the next committee, Kartar Singh Committee, it is also known as Committee on Multi-Purpose Workers under Health and Family Planning. And the purpose was to study and make recommendations of the following: structure for integrated services, feasibility of having multi-purpose workers and bi-purpose workers, training requirements for such workers, and the utilization of mobile service units of family planning program. And some of the recommendations are auxiliary nurse midwives to be replaced by female health worker and basic health workers. Along with that, basic health workers and the malaria surveillance workers, vaccinators, health education assistants, and family planning assistants are to be replaced by male health workers. And it recommended one PHC for 50,000 population, and one PHC is divided into 16 subcenters, and each subcenter having 3,000 to 3,500 population. And one subcenter is staffed by one male and one female health worker, and one health supervisor is recommended to supervise 4 health workers. And now coming to the next committee, Srivatsa committee, it is a setup also known as Group on Medical Education and Support Manpower. The purpose was to devise a suitable curriculum for training a cadre of health assistants to suggest steps for improving the existing medical educational processes. And some of the recommendations are creation of bands of paraprofessional and semi-professional health workers from within the community itself, like teachers and postmasters, etc. Establishment of 2 cadres of health workers, multi-purpose workers and doctors at the PHC. Development of referral system, that is the link between the PHC and the district hospital or the medical college. Establishment of medical and health education commission, and one male health worker and one female health worker for every 5,000 population. One male assistant for 2 male health workers. One female assistant for 2 female health workers. And the health assistants should be at subcenter and not at the PHC. And now coming to the Rural Health Scheme 1977, the recommendations of the Srivatsa Committee led to the launching of this scheme. Training of community health workers started during 1977 to 78. Involvement of medical colleges in the total healthcare of PHC was initiated. And the reorientation training of multi-purpose workers engaged in the control of various communicable disease programs into unipurpose workers. Thank you.